Welcome back, Care Pioneers. Today, I had originally planned to start the second pillar of well being in our series, which is the mental aspect of well being for caregivers. But there's something else that's taken precedence that I really wanted to bring to your attention, and that's the Medicaid cuts or the potential Medicaid cuts. There will be Medicaid cuts, but it will affect the majority of older Americans and seniors. So I wanted you to have the facts so you can be prepared. And if any of this concerns you, or may involve you, your loved one, or someone you know, that you are prepared. Time is of the essence here. It is really imperative to contact your congressional representatives ASAP to let them know how it will affect you as a family caregiver and your loved ones. Now, some of you may be watching and aren't from the United States, and I understand that, but this is so important for the United States family caregivers and their loved ones. This may be a little longer than usual, but I promise you it will be worth it for you and will bring you dividends in the future. So please stick with me. Now, this is not meant to be political, and I am not suggesting that I am advocating which side of the aisle you should be on. I'm on no side of the aisle except when it comes to family caregiving and our loved ones and this disabled and chronically ill. What is best for them? That's all I want. My only purpose here today is to inform you about the proposed federal budget that passed the House, which will require significant Medicaid cuts. And these cuts can directly affect our loved ones and us as caregivers, even though they may not intentionally be targeted toward us. And our loved ones don't necessarily have to be on Medicaid for it to have a significant impact. Let me repeat that. Our loved ones do not necessarily have to be on Medicaid for it to have a significant impact, because it may also impact some of the programs that you don't realize that Medicaid pays for, and also Medicare. So I'm Susan Lieberman, and many of you know me, but I am a nurse, a grief educator, a healthcare advocate, a health and life coach, and a family caregiver coach, mentor, and advocate. And what do I mean by advocate? It means that I monitor and try to stay up to date on legislative changes that will or are likely to affect or have affected seniors and the disabled and their caregivers and their families. I have been to Capitol Hill. I have been to my state legislature. I have talked to the lawmakers on several occasions. So, and I also have an MBA in healthcare administration and was in the healthcare field on both the administrative and direct clinical caregiving side for many years. So, just wanted you to know that this is not anything to do with politics. Again, I want to stress that. But before we go into how it could significantly impact senior citizens and people with disabilities and family caregivers, it's important to understand the basics of the Medicaid program, who it covers, because it's not what you might think. So, first, let's review the magnitude of the issues and the statistics. So, there are over 72 million Americans that are covered through Medicare and also CHIP, or the Children's Health Insurance Program. That includes 40% of all births in the United States and over 50% in rural areas. That is huge. Approximately 21 million Americans are covered by the by the Medicaid expansion program. through the Affordable Care Act, or what you may know as the healthcare marketplace. And here is some statistics that are staggering for us as caregivers and disabled and older Americans. Medicaid pays for 62% of all nursing home resident care. Let me repeat that again. Medicaid pays for 62% of all nursing home residents. It is very expensive to keep paying for that care with most of us and our funds or our loved ones. So this is important if your loved one will need to go to a nursing home at some point in the future, and you never know. Seniors and the disabled, they account for over half of all Medicaid spending, although they're only about 20% of the beneficiaries. Medicaid spending over half just on this alone. And 70% of seniors will need some sort of long-term care in the future in their lives. And it's also important to know that more than 90% of all non-disabled Medicaid recipients work either in low-paying jobs, so they can't afford insurance, or they're working part-time, or they've had to quit work to be able to take care of a loved one. So that includes family caregivers here. This is important to understand. And because these statistics involve seniors and the disabled, or you, or your loved one, a relative, or someone you know, likely may need assistance from the Medicaid program, either now or sometime in the future. So let me give you a high level of how the Medicaid program works so that you understand who's covered, what's involved, and what's possibly at stake. So, Medicaid is a joint federal and state program that covers primary and acute care services as well as long-term care services and supports. Medicaid calls that LTSS. I won't put too many acronyms in, but that's a good one, LTSS. And they provided for low-income populations, including children and their families, seniors, disabled individuals, children with special needs, and other adults. So here's how it's paid for. The federal government pays a share of the state's Medicaid expenses based on their formula, and I won't go into it, it's kind of complicated, which varies from a federal floor of paying up to 50, or a federal floor, a minimum of 50%, and up to a maximum of 76% of the spending in each state, depending on the state's per capita income relative to the national average. Currently, there is no upper limit or cap on the federal Medicaid matching funds that a state can receive, and that allows the states to obtain more dollars as healthcare costs rise. And you know, healthcare costs have tremendously risen and will continue to do so in the future. And the states administer the Medicaid program, not the federal government. So these LTSS, or long-term support and services, help people with chronic illnesses or disabilities really also not only in nursing homes, but live independently in the community. So they include medical and non-medical care and can be provided in the community or in a facility such as a nursing home or a memory care unit. And this is how it works for a senior who has to go to a nursing home, skilled nursing facility. A senior must have assets under $2,000 to their name to qualify for nursing home Medicaid. And anything more than that must be what's called spent down from the countable assets. Once you've spent that down, then you can qualify to receive Medicaid benefits. So, example, my mom was a cleaning lady all her life. She didn't have a lot of assets, but whatever she did have, we had to spend down before Medicaid would kick in to pay for her care, which could be for many years. I don't know how long she will live in the condition that she's in. But in exchange for that, Medicare covers your nursing home costs, but you have to give up all your income to Medicaid. So any Social Security benefits, anything else must be given up to Medicaid. You will, however, be, or your loved one will be able to keep a small monthly stipend, and that amount varies by state. I believe my mom gets about $50 a month. That's it. Okay. So, states are required to provide these long term care services in nursing homes. They are not required to do anything for community care. So, they get voluntary waivers to do this, and those are the community based services such as paying for medical equipment you may need at home, limited payment for some home health aides, limited, but there is some help out there. Respite care, so if you need to a day off or you need to go on vacation, you can get that. Compensation for family caregivers in states that allow that, family caregiver training programs, and so much more. Currently, Medicaid serves about 4.5 million people through the home and community based services. And they cover things that Medicare typically won't. I'll go into that a little later. So it also helps, and this one's important. How Medicaid helps millions of older adults pay their Medicare cost sharing, because there is a cost sharing with Medicare, not Medicaid, Medicare. And Medicaid helps pay for that. So it helps cover vital benefits that Medicare doesn't pay, such as dental, vision, hearing, and medical transportation or transportation, let's say, to doctor's appointments and all of those things to help our loved ones stay independent in their homes in the community. There's also one other thing that's at stake here. It's called the Older Americans Act, and this one is very important too. This is a federal law that provides funding for a nationwide network of services and supports aimed at enabling older adults to live independently in their communities, including programs like nutrition services. You've heard of Meals on Wheels, and several millions of seniors are on this program. Adult day programs, so if your loved one goes to an adult day program, caregiver support, elder abuse prevention, this is a big one, and also they help for that transport to things such as doctor's offices so that older adults can stay at home. And the way this is administered is that grants are given to states to distribute the funds to local service providers. Unfortunately, this act expired last year and requires reauthorization by Congress to continue funding these programs for older adults, regardless of whether they're on Medicaid um, and if they're on Medicare, okay? And it's in danger of being cut. So these are huge. So even though you or your loved one or someone you know may not be on Medicaid now, you may still be receiving services and benefits that Medicaid pays for. And here's the problem. The House passed a budget recently requiring $2 trillion in federal spending cuts. They are directing the Energy and Commerce Committee to cut 800 billion over the next 10 years. And here's the rub. Although they didn't specifically say cut Medicaid, this committee has jurisdiction over Medicaid and other healthcare programs, but the majority of it is Medicaid, which will, and I will emphasize that, which will require significant changes and cuts to Medicaid. So the goal, as stated, is to eliminate waste, fraud, and abuse in Medicaid. And these efforts should continue. They have been ongoing and they should continue, and they should continue even more vigorously. However, the facts are It's estimated that less than 10% of all payments were made improperly, mostly due to inaccurate paperwork because the paperwork requirements can be onerous, or there's insufficient paperwork, or it wasn't updated, rather than the actual fraud and abuse. I won't go into that, but in a former career, this is something that I dealt with all the time for physicians. And so I personally know what it's like. Medicaid, by the way, is one of the most cost efficient forms of government or of coverage. It has lower total and per capita costs than any other form of coverage. That includes Medicare and private health insurance. So it's already pretty efficient. So I wanted you to know that it's like really important to know. Okay, so now we get to the nitty gritty. What are the possible Medicaid program challenges or changes and cuts that will directly affect you and your loved ones? The first one is work requirements. And most likely, this will pass. It will require every able bodied adult to work. And you may say, that's great. And I agree. But remember, 90% of Medicaid recipients are already working. And such work requirements would probably exempt older adults, but it wouldn't protect adult children or family caregivers who leave paid work or work only part time to so that they can act as family caregivers for their loved ones. So I need you to understand that. There might be changes to look back requirements. I don't want to get into it in any great details, but just to give you a high level overview, currently, Medicaid requires a 5-year look back on the applicant's assets to ensure that they're not being given away or transferred because Medicaid wants its money, right? This could be extended to a 10-year look back program. This would decrease eligibility for many seniors. And I've recommended this before. I'm going to recommend it again. It is vitally important to seek out the advice of someone who knows estate planning and elder care law, both for you as an adult child or an adult taking care of a loved one with disability, and for your senior or the person who is disabled. It is vitally important. And I'll explain a little later why the 10-year look back is going to be so hard to do. So another thing that might be changed is how is called Medicaid repayment. The federal government may require, or the states may be forced to require, the heirs of Medicaid recipients to repay the program. That means people in nursing homes. For example, if someone receives $50,000 in Medicaid services during their lifetime, their children would have to repay after their parent dies. This is huge. I want you to get the impact of it. Now that there are some caveats and all of that, I don't want to go into. I'm not a tax attorney, but that's something that you should know about. The other thing is that they may cut the basic formula or caps on the amount of federal government contributions to the states, either by lowering the minimum 50% government contribution, remember it ranges between 50 and 76% to the states, or by capping how much they will give per capita, which means that after money's gone, it's gone. And if there are increases to healthcare costs, well, that's not calculated in. So this is what it's going to do. If this occurs, which is pretty likely, it'll force states to, number one, either decrease who's eligible for Medicaid, cut services, or increase state taxes. And my guess is it'll probably do all three. So basically, it's a cost shifting from the federal government to the states. So while you may receive some decrease in your federal taxes, you may receive an increase in your state taxes. Very likely. So, and here's another huge one, so concerning: cuts to federal programs and vital programs for seniors and people with disability. And the first to go will be the community based services because the states are not required to cover them, such as payment for medical equipment that you need at home, limited payment for home health aides. That's not easy to get from Medicaid, but it's possible. Respite care if you need to go away for a little while, compensation for family caregivers if your state allows that, elder abuse program, caregiver training programs for conditions such as Alzheimer's and developmental disabilities, and also cuts to nursing home care. And I'm going to go into that a little later. There's also another big one besides Medicaid. It's called the Older Americans Act. And this act provides programs that are funded under this act. And if it's not reauthorized this year, it expired last year. If it's not reauthorized, here are the results. Many programs will vanish for seniors, such as Meals on Wheels, adult day programs, caregiver support, elder abuse prevention, transport for seniors to doctor's appointments, and things like that, because it funds the things I was talking about before. It's vitally important. So, now, lastly, after all of that, you may say, "Well, I still don't really get how what I can do and what I need to be asking for." So that's up to you. If this concerns you, that's up to you. And certainly, if you don't find this concerning, that's okay. I just wanted to make you aware of it. Again, I am not advocating any political view for any side of the aisle in the US political system. That is not my intent. But if any of this concerns you, for yourself, for your loved one, or the people you know, then there are things that you can do before these cuts are made, because some of this may not be intentionally done. It's just a byproduct, and our representatives need to be reminded of what your needs are as a family caregiver and the needs of senior citizens, because this is so important. Here are some ways that you can advocate for yourself or your loved ones. The first is to contact your congressional representatives, that's your House representatives and your senators, and let them know what it is like to be a family caregiver and the impact that these changes could have on you and your loved one. They may not be totally thinking all of this through, and they need to know that they are representing you and what your needs are. If you don't know who your representatives are or your senators are, it's easy to find out. You can go to congress.gov, and or it's congress.gov/members/find your member, and I'll put that link in the comments, and you'll know exactly who they are. The second is attend town hall meetings, because it's another way to let your representative know, or representatives know, what your needs are as a family caregiver, your needs and your loved one's needs. And the third I would say is to just understand the talking points that you may want to have. Let your representatives know you don't want certain aspects of the Medicaid program touched. Some things that you might want to include, and it's up to you, would be a work requirements exemption. So request an exemption for family caregivers who work part-time or who quit their jobs to take care of their loved ones. And many of my clients have had to do that. Okay. The second talking point would be keep some vital programs. This is crucial, especially for those community-based programs, to keep seniors out of nursing homes. Nursing home care is more expensive than care at home. That's a whole nother Another topic that I don't want to get into today, but this is a fact. Okay. And these in programs, I've already told you, but I will reiterate them again, include transportation for seniors, nutritional programs like Meals on Wheels, home care services, provision of medical equipment, adult daycare programs, respite care programs, abuse prevention programs, and compensation for family caregivers in some states. Here's another one. Number 3, urge them to reauthorize the Older Americans Act. Excuse me. Because this funds some of these programs that I've just mentioned. So it's vital to preserve that. Number 4, continue the 5-year look back program instead of a 10-year look back program, especially for seniors and their children who may not know their parents' finances from 10 years ago. I can tell you that happened to me. My mom had dementia. She wasn't able to tell me, and I didn't know. Okay. So it's very onerous, very, very onerous, and could limit eligibility for people who really need it. In addition, you want them to disallow Medicaid for coming after the deceased children's or the coming after your loved ones after they have died to recoup the payment from you. Another one, I believe that's number A, B, C, D, E, F, E, number 5. Okay. Don't touch Medicaid nursing home resident benefits. Again, don't touch Medicaid nursing home resident benefits. This includes not limiting their eligibility or access to care or covered services, or reducing funding for nursing home care. This would significantly affect the quality of the majority of seniors and nursing home residents in the United States. This is crucial. And also, lastly, to continue helping seniors with Medicare cost sharing. Millions of seniors depend on Medicaid to help them with the cost sharing requirements of Medicare, and also so that they can have access to dental, eye, and hearing services and other services that Medicare just doesn't cover. And I know this from firsthand experience and from working with my clients. So there's certainly much that can be improved to make care more efficient and effective for older Americans and people with disabilities through Medicaid, but not at the expense of health and long-term care for seniors. Let's do this in a way that works. So again, this is up to you, but I wanted you to be informed. And if you want more information updates, if you're not already in my family caregiver community, or if you're not here regularly, please come. Please join and please participate, because I will give updates and continue advocating for you and your loved ones. I have done this all my life and I will continue to do it. I'm very passionate about it. I also help family caregivers navigate the healthcare system, get the quality of services that you and your loved ones deserve, and help you with strategies, practical strategies to care for your loved ones without giving up your health, freedom, and life. So I know this was a little longer than usual, but it's that important that I decided to do this. So from my heart to yours, see you next time when we will continue to another topic. Bye, everyone.